Nearly 2 years into this pandemic, we're starting to see advances in treating COVID itself. But long COVID, this constellation of lingering health problems that some patients experience, really so much still remains understood at this point, Diana.
Absolutely. Except for I would go so far as to say that much of what we have learned about how to treat COVID, we no longer have the options of using anymore. So right now, I know that everybody had been relying on monoclonal antibodies. They are not effective against Omicron. And there is only one that is effective, Sotrovimab, and it is impossible to get. There are 50,000 doses in the entire country. So do not assume that you are going to be able to get your hands on that if you do get a COVID infection right now. There is no safety net right now. There is no available early intervention. So please keep that in mind when you are making your risk assessments. There's no backup.
I think when people hear about Omicron and the possibility that maybe you have a milder infection, I'm not sure that everyone understands how many people are dealing with long COVID, even if they were asymptomatic or had a mild infection, Diana.
Absolutely. So I believe that there's truly no such thing as a mild case of COVID, because even a case that presents as a runny nose, and that's it, and that's your only symptom, or if you're completely asymptomatic, you run the same risk of developing long COVID as if you were in the hospital. So that is really, really important to keep in mind, that long COVID is not a direct result of the most serious infections. They can often be the mildest, and there's no way of predicting which bucket you're going to fall into. In fact, if you're young and healthy, your risks might be lower of not ending up in the hospital, not ending up on a ventilator. But the younger and healthier you are, the more robust your immune system is. Actually, the chances of your getting long COVID are higher, because one of the theories is that it is an unregulated over-response of the immune system. So the more robust your immune system is, the more, in trouble you could be. And we're talking about really severe symptoms. And we are now seeing that COVID stays in the body for months afterwards. We don't know how long. This is from a recent report just out this week done on autopsies,
Right.
where they found COVID still present in every organ, including the brain.
The brain. That was what was so incredible, that NIH study. We're going to get to that in just a second, but I want Rachel to also share her story and what this has been like for you, Rachel.
Oh, this has been the hardest thing that I've ever gone through. So I developed symptoms March 13th of 2020, tested positive March 17th while they were still allowing tests to happen. I was one of the, people to get the last of the tests. And I developed symptoms, headache, fever, a lot of gastro symptoms, and loss of taste and smell, and also tachycardia, which I had no respiratory symptoms, but I found myself going to the ER 2 or 3 times during that first and second week, because I couldn't stop my heart rate from going from like 65 to 140, 150. Of course, nobody knew anything. Got to the emergency room, it was all anxiety. It wasn't until a month later I went to a cardiologist, and then things started, people started having similar symptoms. And fast forward to the post-COVID care clinic at Mount Sinai, where I was actually diagnosed with POTS, which seems to be a very common post-oral tachycardic syndrome. It seems to be a very common syndrome that a lot of post-COVID people are developing. And I've had since then tremendous numbers of symptoms in every organ system of my body. I've had the tremors, I've had gastro symptoms, I've had cardiac symptoms, blood pressure symptoms, hair loss, and 2 years almost, I'm still experiencing symptoms. And the worst part of the whole thing is that people really don't seem to really get it. They're like, wow, you look so good. They don't get that there's actually a lot going on that
Right.
people don't see.
And I
And
know.
we're not,
Oh,
yeah, sorry.
yeah, no,
Go
I
ahead.
was going to say too that, I know Diana's been trying to work with the scientists and get as many people like you, Rachel, who are having these symptoms, get that data so that we can have some type of a coordinated effort on this.
Yeah, and the Mount Sinai post-COVID clinic and clinics like that have been good. I mean, they were my saving grace. When I went to them in August, I got my first appointment there because there are doctors there that are interested. They always tell me they don't know enough yet. The data is not enough yet. I'm still waiting for the data to be enough, but at least they were able to give me some support. And
Sure.
that's something I wish everybody could have. And I know you don't have those post-COVID care clinics in all states and all countries, and that's a problem.
Right.